What are the 10 warning signs of Alzheimer's disease? Memory loss, especially recent memory loss that affects job skills. Second, difficulty performing familiar tasks. Third, problems with language. Just can't find the right word, or your fluency decreases. Fourth, disorientation to time and place. Fifth, poor or decreased judgment. And this becomes very important, especially when bills have to be paid, or when someone is trying to take advantage of you, recognizing that you're not quite in your right mind. Sixth, problems with abstract thinking. And this, of course, will affect our ability to make decisions. Misplacing things, the great purse hunt, the great wallet hunt that occurs day after day. Eighth, changes in mood or behavior, generally one of apathy, one of indifference. Often people consider that person being depressed, but they're really not. They're actually void of thought. Changes in personality, and that is sometimes the individuals become aggressive, do things that they normally would not. And finally, a loss of initiative. They just never seem to get anything done. They don't bathe, they don't do the dishes, and they don't care for the other individuals who they normally would. You can see the actual pathology of Alzheimer's disease, what occurs within the brain. One can see the cells and these dendrites or connections between the cells. Amyloid plaques, which is a proteinaceous substance, sort of like an acid that eats out the various different connections between two cells, occurs. Also, fibrillary tangles occur within the cells and then actually destroy the cells themselves. This was first recognized by Louis Alzheimer's in 1906. There is a tidal wave epidemic of Alzheimer's that is affecting the 77 million baby boomers, including 40 million Americans over 62 years of age. If one looks at the statistics, those over 65, it has increased from 1954 from 500,000 to over 5.4 million in 2005. For those under 65, it has gone from 25,000 in 1954 to 2005, 620,000. In fact, there's a 5% increase every 3 years. And more important is that it is estimated that 40% of the baby boomers will eventually get Alzheimer's if they live long enough. The prevalence. If one looks here, at 60 years of age, the average prevalence is about 1 in 100. If you're at risk, it can be as high as 1 in 10. Or if you use the anti-Alzheimer's prescription, you should reduce that prevalence to 1 in 1,000. Look at this figure. At age 65, the average incidence is 1 in 10. If you have the risk factors, it could be as much as 2 in 5, or with prevention, 1 in 100. At 85 years of age, very sobering, 1 out of every other person in the United States has Alzheimer's disease. You could increase that chance or that risk to 4 in 5 when you don't reduce your risk factors. And always remember, there are 50% of the people at 85 who have the disease, but there are 50% who don't. And that is one of the reasons why I wrote the anti-Alzheimer's prescription. In the last 6 studies, all have failed. We have spent $20.2 billion, and what we have found is those patients who were on the placebo did better than those who were in the trials. Alzheimer's disease is truly a disease of the affluent lifestyle. The U.S. has 3% of the world's population and 18% of all Alzheimer's disease cases. In fact, if you add Europe and Australia, you will see that despite them having only 8% of the world's population, we have over 42% of all the cases of Alzheimer's disease. Well, I think that gives you the answer for the treatment or prevention of Alzheimer's disease. It is the affluent societies that are getting the disease. And the reason for it is their sad lifestyle. And what I mean by sad lifestyle is that S stands for sedentary, that is, they don't exercise, sleepless, that is, there's a marked reduction in the amount of sleep we get right now than we did in 1954, and stressfulness. Then A stands for aging, and that we do have an aging population. There's no doubt about that, and that is an intrinsic risk factor. And finally, our diet. A diet which since 1954, we have fourfold the amount of refined carbohydrates that we take in, and 6 to 8-fold increase in the trans fats that are eaten.